What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. Today's video, we're covering why you should become an X-ray tech versus other medical fields. So to give you context, I am a night shift tech. Been doing it for 4 years. Also dabble in a lot of overtime, so I do work days. So to give you context, I, in my family, am surrounded by medical workers. I have my lady who's a nurse. I have one, I think my wife's cousin does physical therapy. There's another one who's an ultrasound tech. There's another one who I believe is like a nurse practitioner. Like there's like a bunch of little worlds. I would say all of them. Maybe the only one who doesn't have it as hard, I would say spot number 2 would be the PT people, physical therapy people. They don't have it. I mean, the job as far as, I guess, the stress level. Well, it is kind of stressful too, but like difficulty and overall wholeness, X-ray would be at the top. Like all of them would say, they constantly tell me like, Miguel, you're so lucky that you're doing this because you don't have to deal with this. And my lady's like, Miguel, all the stuff I gotta do, I hate it. I'm stressed. Should have done what you doing because you literally come in, just beep, and then just out 30 seconds in and out. Like you will hear that all the time. Like if you don't want to deal with a lot of patient care, you do x-rays. If you're just doing a chest x-ray, 30 seconds in and out, baby. Maybe a minute if you clip it. Like literally, it's a good gig. Work at the hospital, yeah, maybe occasionally you may end up in certain situations where there's a lot of blood. Someone's stuff's broken, or you'll have people crying because their stuff hurts because they're broken or they're in pain and stuff like that. But like besides that, we really don't be doing a lot of patient interaction. It's just kind of straight, get there, get the best pictures, go back, put it online, and just chill. Especially a night shift. At night shift, we have a set amount of portables that spawn in. As soon as we do all those, it's literally RNG, whatever shows up in the ER. If nothing shows up, we just chilling. Other people who are respiratory and other stuff, you constantly have to be checking on your patients. If there's no order or we don't get called, you don't got to check on no one. Now, maybe if you're curious about stuff, or if like they have certain stuff like pneumonia, you may like look more deeper because something like that could, drastically, affect someone's care and stuff like that. But besides that, like ultrasound, they have to both take the images and then document what they saw, and then the rad looks at it and be like, oh, okay. We don't. We just take the picture. Everything's there. Boom. That's it. Literally, that's it. That's the best. Or if even if it's not good, you just document it. Wasn't able to get best, whatever. As far as medication, like for nights, you don't gastrographin. That's about it. GJ tubes. Like you really, except if you're in Maine, you may deal with barium and other stuff like that. But besides that, we really. No, maybe, you got to be careful if they're allergic to contrast. That'd be about it. But compared to my lady who's a nurse, all the medication, you got to be on top of the dosage. You got to be liable if you lose it. You got, there's so many other stressors that is involved. Like my lady does nurse, okay? She does mobile nursing. At the end of the day, she has a long list of charting and all the stuff. And she's stressed about, I gotta do all this, or leaving work, tomorrow I got this, As soon as I leave the hospital, my job is back there. That's it. I'm done. I don't gotta worry about it. Maybe occasionally I'll stress and be like, dang, we have an update to the system during the night shift. That's notorious to happen. I'm gonna have to put stuff manually, or the good portable isn't working. I had to use the other one. Which in grand scheme is really insignificant compared to some of the other stuff, the stress. I would say the most stressful part about my job, it was the school. Right now, it's literally just chilling, taking chest x-rays here and there. It's a good gig. I would recommend it. I know the enema is something that people can't do because essentially, if you don't know, you grab a little tube, put it at someone's other region, and you just put them either contrast or air up in their stuff, and you get to see all their intestines and stuff like that. I mean, even in night shift, it's never 0%. There's always a 1% that it could happen. Amongst my 4 years of doing it in night shift, I've only had to do a true fluoroscopy exam, only one, and it was like an esophagram. So I would say, yeah, that's a pretty good rate. And then another time, the other day shift was there working night with me, so I really didn't have to worry about it. So it's a pretty good gig. Now, granted, you are in the realm of radiation, so you constantly have to be careful, keeping yourself safe and stuff like that. So that could be a difference of people who are not wanting to join because they're scared of radiation and stuff like that. But I would say it's a good gig. And yeah, it's been what we got. See you on next.